All right, let's jump right in. Today, we're talking about a connection in the body that sounds, well, kind of weird. The one between your gut and your lungs. It turns out that inflammatory bowel disease, or IBD, isn't just a gut thing. It can actually cause some really serious issues way outside the digestive system.
So, let me ask you straight up. Can a disease in your gut really mess with your lungs? You might be thinking, no way. But the answer is a big, resounding yes. We're starting to understand that IBD is so much more than a gut problem. It's what doctors call a multi-system illness, which is just a fancy way of saying its symptoms can pop up in all sorts of unexpected places outside the intestines.
And get this is not some super rare 1 in a million thing. The numbers are actually pretty staggering. Recent studies are showing that up to 58% of people with IBD might have some kind of abnormality in their lungs if you screen for it. That's more than half. It just goes to show you this connection is something we absolutely have to get our heads around.
Okay, so you're probably wondering, how on earth is that even possible, right? How does a problem that starts in your gut make its way up to your lungs? It feels like they're two totally different worlds, but the secret, it turns out, is hiding in our body's own security system.
Here's the key. Both your gut and your lungs are lined with something called mucosal tissue. Think of it like the body's bouncer. It's the first line of defense against anything from the outside world. And because they're built from the same kind of stuff, they're hooked into the same immune system hotline. And, just like with any communication network, when the signals get crossed, that's when things can start to go wrong.
A really great way to picture this is as a kind of biological superhighway connecting the two. And scientists have a pretty cool name for this superhighway. They call it the gut-lung axis.
So the gut-lung axis isn't just a one-way street. It's a constant two-way conversation. It connects all those trillions of bacteria living in your gut, what we call your microbiome, to your immune system, and, you guessed it, your lungs. This is seriously a new frontier in medicine. We're now seeing hard proof that when you get inflammation in one spot, it can send out an alarm that triggers a similar reaction in the other.
This whole process is like a chain reaction, or what you could call an inflammatory cascade. It's like dominoes falling. First, it all kicks off with an imbalance in the gut's bacteria, a state called dysbiosis. Then, this imbalance makes the immune cells in the gut lining totally overreact. From there, these fired-up immune cells and their inflammatory messages jump into the bloodstream. And for the final step, they basically take an exit ramp at the lungs, where they set up shop and cause the same kind of inflammatory mess all over again.
Okay, so we know how it happens, but what does this inflammation actually do to the lungs? When the lungs start sending out these distress signals, it can show up in a few key ways. Let's break them down.
So, the first place we often see trouble is in the large airways. Think of these as the main highways for the air you breathe, your windpipe, the trachea, and those big branches called the bronchi.
When these get inflamed, you can end up with things like chronic bronchitis, that nagging cough that just won't go away, or even inflammation of the windpipe itself. But the one that pops up most often is a condition called bronchiectasis. Now, what that means is the airways actually get permanently stretched out and scarred, and that makes it really, really tough to clear out all the gunk and mucus.
And this really shows you what we're talking about. Look at the healthy airway over here. It's wide open, the walls are thin, air can just cruise right through. Easy. But now look at the IBD-affected one. See how the walls are all thickened and swollen? That passage for air gets so much narrower. This is exactly the kind of damage doctors are looking for on scans.
But the trouble doesn't just stop at the main highways. This inflammation can also creep into the smaller, deeper airways, all those tiny little branches way down in the lungs. And what's really sneaky about this is that in the beginning, you might not feel a thing. The damage can be happening silently, which is why it's so tough to catch without very specific tests.
And it can go even deeper than that, right into the lung tissue itself. We're talking about that delicate, spongy part of the lung, the parenchyma, which is where the magic happens, where oxygen gets into your blood. Now, diagnosing this is a real challenge because the symptoms, a cough, feeling out of breath, they look exactly like a common infection.
There are a few different types, but the one we see most is called organizing pneumonia, or OP for short. And let's be clear, despite the name, it has nothing to do with a typical infection. It's all about inflammation. It's a condition where these little plugs of tissue and gunk literally fill up the small airways, creating tiny roadblocks that stop air from getting through.
Okay, so we've seen the problem and the many ways it can show up in the lungs. The big question now is, how do doctors figure this out? And even more important, what can they do to fight back?
Well, the first thing to know is that this is not a one-person job. Because the lung symptoms can be so vague and look like so many other things, figuring it out is like putting together a really complex puzzle. And you can't solve this kind of puzzle with just one specialist.
Nope, you need a whole team of experts working together. You've got your gastroenterologist, who's the gut specialist. Then there's the pulmonologist, the lung expert. You need a radiologist who knows how to read the scans and spot the clues, and a pathologist to look at tiny tissue samples under a microscope. It's only when all these minds come together that you can really connect the dots and get the right diagnosis.
But wait, there's another big risk we need to talk about, and this one is crucial. All that inflammation floating around the body from IBD can actually make your blood stickier, which seriously raises the risk of blood clots. In fact, patients with IBD are at a 3 times greater risk of these clots. And that is incredibly dangerous, because if one of those clots travels to the lungs, it can be life-threatening.
So how do we treat this? Well, it really depends on the specific problem. But generally, the first tool out of the toolbox for both airway and lung tissue inflammation is corticosteroids. These are super powerful anti-inflammatory drugs. Now, if the problem is really stubborn and those don't do the trick, doctors can move on to other options, like immunomodulators, which kind of turn down the volume on the whole immune system, or even biologics, which are really targeted drugs that go after the specific signals causing all the inflammation.
All right, we've gone through a lot of complex science here. So let's bring it all home. What does all of this actually mean for patients? What's the bottom line?
If there is one thing, one single thing you take away from this, let it be this. IBD is a complex disease that does not always stay put in the gut. The inflammation can and does travel. So for anyone with IBD, a new cough or feeling short of breath shouldn't just be brushed off as a cold. It could absolutely be connected.
And it's really important to know this is a field of medicine that's still very much a work in progress. I mean, listen to this quote from one of the research papers we used for this explainer. Further research is needed to develop evidence-based guidelines. What that tells us is that scientists are actively working on this stuff right now, trying to create a clear playbook for doctors on how to diagnose and manage these lung issues.
And that leaves us with one last, really fascinating question to chew on. This whole gut-lung axis is probably just the tip of the iceberg. As we get better and better at understanding just how powerful our gut microbiome is, you have to wonder, what other incredible, unexpected connections are we going to discover inside our own bodies next? It's an exciting time for medicine. Thanks so much for joining me.